The number of COVID-19 patients in Rhode Island's hospitals has hit its lowest point in more than 2 months. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. As of Saturday, there were 347 people in the hospital.
Sadly, another 27 people have passed away, bringing the state's death toll to 2,110.
The state's Department of Health says the daily positivity rate is at 3.8% and over 14,000 people have been fully vaccinated against COVID-19.
These numbers tell us roughly 40% of the vaccine in Rhode Island has not been used. That has many people wondering why.
12 News reporter Brandon Truitt spoke with those leading the vaccine rollout in Rhode Island. He's live at the Department of Health with the reasoning behind the numbers. Brandon?
Well, Mike and Shannon, it could all be a little shocking when you first hear this. 40% of the vaccine in Rhode Island is sitting in freezers. The state says that number can be a little deceiving, offering this explanation.
100% of vaccine is accounted for, I guess I should say, except for the ones in transit to the state of Rhode Island.
Unused but assigned. That's the message today from the Rhode Island Department of Health.
The biggest factor in getting vaccine out is that we just don't have the supplies.
Right now, the state says it's walking a tightrope, trying to balance how much vaccine it can give out and when. Dr. Philip Chan with the Rhode Island Department of Health says there are several reasons behind the 60-40 split. Nearly all of the unused vaccine is already assigned, either to CVS or Walgreens for distributions in senior centers, or a certain amount on standby for second doses.
Can't just give them the second that we have them, right? Those second doses have to be administered in a very certain time frame.
Holding back second doses, part of the plan. All of this comes as reports show states like Oklahoma, Montana, and West Virginia are getting out a higher rate of vaccines than Rhode Island. Leaders in West Virginia citing their choice not to join the federal plan. That's linked many states with CVS and Walgreens. Rhode Island has signed on with the pharmacies.
Seems like one of the cons of this is that it can potentially slow some of the vaccine allocation.
Dr. Philip Chan could not say if the CVS partnership has slowed down distribution in Rhode Island, but believes the pros outweigh the potential cons.
I would say, though, the benefit of using that is that all the logistics were planned for, and in some cases, one may say they could even have sped up.
Dr. Chan, the first to admit that people may not be happy hearing this. He says that they are doing all that they can to give out as much vaccine as possible based on the amount that they're getting in. Live in Providence, Brandon Truitt, 12 News.
First tonight, we're working to get answers about why Rhode Island seems to be trailing other states in vaccinations. Good evening, I'm Shannon Heggie.
I'm Mike Montecalvo. The health department has said they just aren't getting enough vaccines to meet demand. As of today, they say close to 15,000 have been fully vaccinated and nearly 60,000 people have received the first dose. But some reports claim Rhode Island hasn't yet used about 40% of the vaccine it's been allocated.
12 News reporter Brandon Truitt asked the Department of Health to shed some light on where the rollout stands. Brandon?
Well, Mike and Shannon, this is all coming as reports show that Rhode Island is being outperformed by states like Oklahoma and West Virginia and getting out a higher rate of vaccine. The state tonight is working to reassure people here that vaccine's not just laying around.
The biggest factor in getting vaccine out is that we just don't have the supplies.
Dr. Philip Chan with the Rhode Island Department of Health saying the state is giving out all the vaccine it can based on what it's getting in.
100% of vaccine is accounted for.
Dr. Chan saying although unused, the vaccine is assigned on standby in some cases, reserved for second doses.
Those have not been administered yet. They need to have appointments. We can't just give them the second that we have them, right? Those second doses have to be administered in a very certain time frame.
Other doses are set aside for CVS and Walgreens, the pharmacies delivering and administering vaccines in nursing homes and other settings.
It seems like one of the cons of this is that it can potentially slow some of the vaccine allocation.
Dr. Chan responding to a report in the New York Times showing West Virginia leading the nation and the percentage of vaccines received versus administered. Leaders there telling the Times they did not join the CVS Walgreens deal, giving them more freedom, they say, with allotment.
It seems like one of the cons of this is that it can potentially slow some of the vaccine allocation.
Dr. Chan could not say if the CVS partnership has slowed down early distribution in Rhode Island, but he believes the pros outweigh potential cons.
I would say, though, the benefit of using that is that all the logistics were planned for, and in some cases, one may say they could even have sped up delivery.
And one of the things Dr. Chan says could help freeze some of that 40% up would just be more vaccine. He's hoping the weekly allotment the state gets will increase soon. Live in Providence, Brandon Truitt, 12 News.